Hi, folks. John Laz is here, licensed agent with The Health Insurance Specialists, coming to you with the inaugural episode of a brand new video education series that I've created called Health Insurance Simplified. And the intention of this series is to break down for people what can be a complex subject and complex ideas into easily understandable terms so that you can make more sense of health insurance and thereby have more peace of mind. So, this first and inaugural episode is about understanding the network types. And there are three network types that you need to know about. One is the EPO, the second is the HMO, and the third is the PPO. Now, EPO stands for Exclusive Provider Organization, HMO, Health Maintenance Organization, and PPO, Preferred Provider Organization. Now, each has its pros and cons, but one thing to know is that with the Affordable Care Act or Obamacare individual plans, those plans only fall under EPO and HMO networks these days. There aren't any PPO network plans in that system any longer. Most employer plans, group plans, in other words, are going to be under HMO or PPO networks. And the individual plans, anything outside of group employer plans, in other words, can fall under any of those three types of networks. So my intention is to help you to understand the differences between these networks so that when you go to choose a plan next time for yourself, your family, your business, that you are looking at plans that provide you the best kind of network that you can possibly get. So the EPO network, first of all, is the smallest network in terms of the number of providers that are part of the network, and it's also the most geographically limiting. So an EPO tends to be more of a metro area network. The PPO is broader in terms of the number of providers that are part of the network and then also the geographic scope of the network. So HMOs can be regional or broader area outside of the metro area that you might live in. And then PPOs tend to be the largest in terms of number of providers and geographic scope. So many PPOs tend to be national in terms of geographic range and tend to have the largest number of providers. Now, what's important here to know about the EPOs and HMOs under the Affordable Care Act or Obamacare system these days is those are the only kinds of networks represented in that system. It used to be that there were PPO network plans under the ACA, but no longer. So it's important to know also that with ACA plans, individual plans, if you go outside of the network, you do not have any coverage. So when you go outside of the network with EPOs and HMOs under the Affordable Care Act system, you have no coverage whatsoever. So strong word of caution there. If you travel and you end up with a medical situation and you're outside of your network, you're going to have to foot the bill for your medical costs. Okay, so really, if you can get a PPO network, that's what you want to be looking for, because PPO networks tend to be, as I said, national in scope, and you will more likely than not have in-network coverage around the country. Okay, and being in network whenever you can be is important because you're always going to get an in-network discount, which can be quite substantial. And in my experience, it can be up to about 55% off the provider's normal pricing on average. Okay. So Other differences, you know, doctors and facilities want to be a part of the PPO network more than the other types of networks. And that's for a couple of reasons. One, a little more prestige perhaps to be a member provider under a PPO network, but also they tend to get paid more than from the other networks. So it is about 80 cents on the dollar when somebody comes to them with a PPO plan in terms of what they get paid by the insurance company. More like 70 cents for HMOs and 60 cents for EPOs. So it's an economic decision in large part for the providers. So other differences are the following. If you want to go see a specialist with a PPO network plan, you can go directly to the specialist. You do not have to go to your primary care doctor first to get a referral. That means you save time, energy, and money compared to having to go see that primary care doctor first. With the HMO and the EPO networks, in most cases, you do have to go through your primary care doctor to get that referral to the specialist. So that conversely means more time, energy, and money on your part because you have to pay the primary care doctor an office visit fee to get that referral. So the other difference between these types of networks is around pre-approval or pre-certification. And pre-certification means that if you were thinking about getting a procedure done or surgery, you have to get that surgery or procedure pre-certified by or pre-approved by the insurance company if your plan is under an EPO or an HMO network. And so it's the insurance company making the call on whether they think that surgery or procedure is medically necessary or not. Whereas with the PPO network, it is your doctor and your doctor alone who makes the call on that, what I think is a pretty important decision. And I'm sure you would agree. So another way of saying that is what's in your better interest if your doctor makes the decision regarding medical necessity of something you think you might need to have done, or the insurance company. Okay, and pre-certification is indeed a way for insurance companies to manage their bottom line and manage their risk. Okay, so those are the thoughts I had for you regarding the different network types. Again, if you can get a PPO network plan, by all means do so. I will say that PPO network plans do tend to cost more in terms of premium, monthly premium compared to the other network types, but for many people it's worth it to pay that modest amount of additional premium to get that quality of coverage and that peace of mind. And I work with a number of plans that are all under national open access PPO networks. And in fact, all of the centers of excellence or top hospitals in the country in the different categories of specialty are member providers of these PPO networks. So that means that with these plans, not only can you have access to the top medical care in the country, should you need it, and this goes for both adult and children's hospitals, and you have that access with these plans because these plans can be taken to or used at any provider nationally, any doctor, any hospital. But what's more, because these providers are in the PPO networks that are utilized, that means you're also going to get the in-network discount, which can be very substantial. And we've sometimes seen discounts upwards of 90%, although I'd say that the reasonable expectation you could have would be a discount of somewhere between 35 and 55% on average. Sometimes the provider is going to offer a lower discount than that, and sometimes higher, and that depends on their contractual agreement with the network. And that agreement says that each time a person comes in with a certain plan that's under a certain network, they have agreed to offer that person a discount or a negotiated price off their normal pricing for their services. So I hope that's helpful to you folks. Again, I'm John Lazis with The Health Insurance Specialist, and I invite you to like, comment, and share below. Signing off for now.